Hi everyone. For this assignment, I chose an outpatient that I had for a while. Her name was Mary, for the sake of this discussion. So Mary was a 42-year-old female, recently divorced and mother of two children, a boy 14 years old who lived at home, and then a daughter who was 19 years old who lived with her father. Mary was recently divorced and unfortunately also in a tragic car accident. She had a TBI and sustained some pretty significant injuries. She had severe expressive aphasia and also non-dominant side hemiparesis, which was in her left side, and overall had a significant change in her life. She had recently moved up north to be closer to her sister so she could assist her with activities on a daily basis. As an individual, Mary lost important roles as a mother and as a person who loved to do crafts and activities. She also enjoyed cooking and shopping for the family, and she liked her job as well. Unfortunately, she lost her job, and when we saw her, she was receiving disability. Her sister now took on roles that had formerly been Mary's roles. She was now the head of the household within their family or group setting, and her sister completed all instrumental tasks of daily living, such as money management, driving Mary's son to different appointments or driving him to school. And the sister would also attend all the school meetings or parent-teachers conferences because Mary was too embarrassed and would get very frustrated if she wasn't able to respond and participate in conversations. Within the community, Mary was withdrawn, and without a job or ability to drive, she withdrew more and more. As discussed in occupational science, patients with expressive aphasia benefit from engaging in personally meaningful, communicative, and social occupations using occupation-based interventions that rebuild identity and agency. In our occupational therapy treatment sessions, we completed cooking activities and named all the ingredients we used out loud. We focused on bilateral upper extremity integration and inclusion of the left upper extremity. We continuously challenged Mary to select activities that were interesting to her, and such as we used ink and stencils for card making, scrapbooking, etc. We also made personalized cards of all the places that Mary would love to visit within the community, and we placed these cards on a ring that we then attached to her purse. So that was her communication ring, and she would pick a card and then hand it or show it to the bus driver, and then they could take her anywhere within the community. They would take her anywhere from therapy, the grocery store, shops, post office, school. And then finally, Mary agreed to take on a volunteer job at a local agency for lower income families. This allowed Mary to interact with other community members who came to the center to shop for clothes and food items. This facilitated social inclusion and self-identity. As Mary resumed some of her formal roles and meaningful occupations as an individual within the family structure and within the community, she regained a sense of self and an overall increased quality of life. Thank you for listening to my presentation.